Dear friends, thanks for the opportunity to present on my concept of integrated ophthalmic trauma units. Now, you must be wondering what is basically in a field of ophthalmology, every field requires some form of training. For cataract, you require to do n number of surgeries for you to be qualified as cataract surgeon. For femtosecond surgeon, you require to do m number of phacos. Similarly, for cornea, retina, glaucoma, oculoplasty, you need to do certain number of surgeries before you can say that you are a specialist. But unfortunately, that's not true for trauma. When it comes to ophthalmic trauma, as soon as you enter into residency, you have the license to operate. So isn't it strange that you have not done enough cataract surgery, but you are certified to do ophthalmic trauma repair? So, what it can result into? Probably something like this, where the concepts about how do you fix a corneal laceration, what suture material you use, what landmarks you use are completely missing. And this can not only happen with a new surgeon but also with a cataract surgeon who has never stitched a cornea but all along been managing clear corneal phaco. You can imagine such a badly done corneal repair with the picture on the left as well as the picture on the right not looking so good with the way that complex corneoscleral tear was managed. So, if you don't know the basics of repair, better not to repair some of this patient. So why do we need to kind of come up with this concept of is it just based on the corneal trauma? But probably we need to come up with an integrated ophthalmic trauma unit, a concept to probably adopt this orphan discipline of ophthalmology. What are the objectives of such an integrated ophthalmic trauma care unit? A, to streamline the care of patients with ophthalmic trauma so that whatever emergency attendance and management of patients are there, it can be taken care, sharing and reducing the workload of our other subspecialty colleagues, and most importantly, to improve the care and management of the patients with the trauma. It can also be formed as a seen as a database for the research, which can subsequently help us in setting up guidelines for prevention of ocular trauma to reduce the incidence of preventable ophthalmic trauma. And for that purpose, we have set up a registry known as iGate registry. It also will help us in imparting training and fellowship to younger ophthalmologists, to conduct public forum and kind of CMEs for awareness about ophthalmic trauma, and to allow us to foster collaboration ties in the field of ophthalmic trauma with international organizations. So unit can also go for a targeted approach about a specific project looking at a project like this, which was a petition filed for prevention of firecrackers and fireworks in India against these firecracker injuries. A concept which will be looking like something like this with a model of ocular trauma care center at tertiary level eye care, patient with history of ocular trauma, activation of trauma team, then to undergo initial evaluation. If it is a polytrauma case, rule of life-threatening injury are managed by a polytrauma unit. But if it is not open, it is not associated with life-threatening injury, it's just an open globe injury. It is to be managed by a primary surgeon who has some subspecialty training in the management of ophthalmic trauma, along with management of other colleagues in the different subspecialties, whether it is retina, whether it is neuro-ophthalmic, whether it is cornea, whether it is glaucoma, to bring them on board at later stage for complex complete team care. With this, we would like to again propose setting up a registry, setting up an integrated ophthalmic trauma care unit, and we are committed for this. We, as means Asia Pacific Ophthalmic Trauma Society. We has been in International Society of Ocular Trauma, and also in collaboration with Chinese Ocular Trauma Society and Ocular Trauma Society of India.